norepinephrine. Norepinephrine is also known as Levophed, right? Or this other one I've never heard before, levoartinol. Yeah, it's Levophed. The slang name for norepinephrine was leave them dead. Leave them dead. Because when you're pulling the norepi out, they're usually pretty bad off. But norepi is becoming the more popular drug because of shortages in dopamine, finding dopamine, and then it's technically better than an epi drip because it has fewer effects on the heart. We're not giving it for a heart problem, we're giving it for a blood pressure problem. So it's classified as a sympathomimetic and a vasopressor. So it mimics the sympathetic nervous system. It is a vasopressor. It is used to raise blood pressure. It's not going to really do a lot in heart rate. It does a little bit. Not like epi does. Epi does a lot. So acts predominantly on the alpha receptors. Where's alpha receptors? Alpha ones. Blood pressure, blood vessels. So it acts predominantly on the alpha receptors, produce constriction and resistance of the capacitance vessels. Squeezes your blood vessels, making your blood pressure go up. Raises blood pressure. Okay. It does have a beta-1 effect. Okay, but it's mostly an alpha effect. So it's probably about 85% alpha, 15% beta. Epi's about 50-50. So, in low doses, the cardiac effect, the beta-1 effect is more dominant. In higher doses, the vasoconstrictor blood pressure effect is more dominant. Okay, so the dose you're going to hear here is really the blood pressure dose. It is your first line. It is the go-to vasopressor drug in neurogenic shock, spinal cord injury shock, as well as anytime fluids does not work. It should be your go-to. Okay, it is a better option than epi. It is an equal option in those situations to dopamine, but dopamine is just hard to find nowadays, so everybody goes with norepi. Contraindications, they're allergic to it. Low blood pressure caused by hypovolemia. What good is it to squeeze the blood vessels when there's no fluid in them? So if they've bled out or diarrhea type shock, hypovolemic shock, are vasopressors going to help? No, in that case, what do they need? Fluids. Okay, and then it's a relative contraindication in pregnancy. Just be a little careful with pregnancy on it. Okay. Side effects: headache, anxiety, restlessness, shortness of breath, hypertension. If you give too much, it's going to skyrocket their blood pressure. Dysrhythmias, chest pain, peripheral cyanosis, nausea, vomiting, urinary retention, renal failure, tissue necrosis if the IV site wasn't good. It's kind of very acidic. It will destroy some tissues. Decreases blood flow to the GI tract. Well, it's vasoconstricting to prime the pump to get blood back, or better circulatory system. It kind of shuts down blood flow to the GI tract. Sympathetic, parasympathetic, so it's a sympathetic, sympathomimetic drug, not a parasympathetic drug. Okay. It does react with some tricyclic antidepressants. Okay. Gets inactivated by alkaline solutions. What do we have that's alkaline? Bicarb. So if I had norepi running in an IV and I push bicarb through the same IV, you might as well not even give the norepi anymore. It deactivates it. So you may want it in a separate IV if you're giving bicarb. Dose 0.1 to 0.5 micrograms per kilogram per minute. So let's do this in our heads. Can we figure out kilograms pretty quickly?
Yeah.
So what would 0.1 micrograms per kilogram?
Decimal over 1.
That would be milligrams. 10% would be milligrams, not micrograms. I'm 100 kilos. I'm lying. I'm 100 kilos. Right? 1 milligram would be 100 milligrams, right? 1 microgram That's 1 microgram. I want 0.1 micrograms. All right, so 100 kilogram patient should get 0.01 to 0.05 mics per minute. You gotta move the decimal 4 places, right? And that gives you the starting point here. Yeah, I know, it's not the easiest one. Volusia County, you guys just go with a straight dose, right?
Technically, yes. It's the same as it would be for an epi drip, so if we're just starting at cardiac level, that 4 it's 17 drops a minute.
Yep. So, Dr. Gershon just used one number here. But officially, it's 0.01 mics per kilogram. I'm sorry, 0.1 mics per kilogram. Pediatric.
What?
Yeah,
you did.
I'm confused, sorry.
The dose, 0.1 to 0.5 micrograms per kilogram per minute.
You were just doing that other number for a 100 kilogram patient.
Correct.
Okay.
So a 100 kilogram patient, that would be,
0.1.
0.1 would be milligrams. I needed
2.
Yeah, it's smaller, it's a pain in the ass.
I see.
All right. Another one of those, like maybe pre-working on a cheat sheet. Pediatric dose. It's half your adult dose. Actually 0.05 to 0.1 mics per kilogram per minute. So, if that's not enough, bump it up. So whatever you figure your drops per minute out to be. Oh, I'm at whatever, 15 drops a minute. And that's not working, go to 30 drops a minute, go to 45 drops a minute. You know, you don't have to go to 16 drops a minute. Just bump it up by the same amount. Yes, sir.
Maybe it's just me, but that math still ain't math. If it's 0.1 micrograms per kilogram, and they're 100 kilos, would it be 100 times 0.1, which would leave you with 1 microgram per minute?
We're here, right? I'm sorry, looking at you.
That's not pediatric either. You just wrote an extra 0 on those.
I did.
It would be
You're right. I'm sorry. 0.1 times that, which would be
1. So it'd be 1 microgram
10.
per minute. 10 micrograms
10.
per minute?
Yeah. I'm sorry. My bad. Shoot me. Sorry for the confusion. 0.1 times 100. 1/10 of 100 is
10.
So it's 10 micrograms per minute?
Yep.
Okay.
That's a lot easier.
My bad. My bad. All right. Got a Nerf gun around, so good game. All right. My bad. So
The other one just
technically 10
used the
to
notebook, what the fuck?
50. Half, right?
Yep.
All right. Pediatric dose is half your adult dose. Okay. Thank you for calling me out on that. Sure. When does it start working? Onset. Immediately, the second it hits the bloodstream, it is working. Immediate onset. When does it stop working? When you turn it off. Within a minute or two, it stops working. And so it's on, it's off. Like it's a pretty quick responsive drug. Peak effects, you're gonna see within a minute. Like it's immediately working, it's gonna get to its maximum working within a minute. So like you get a response right away. So it's one of those like, oh, blood pressure sucks, boom. All right, norepinephrine on, let's get another blood pressure. By the time you get another blood pressure, this thing's already working. Still sucks, all right, double it. You know, like you can very quickly titrate this one in. Pregnancy category C, but may cause fetal anoxia, cut off oxygen blood flow to the placenta during pregnancy, which is why you really don't want to use it during pregnancy. It's not going to kill the baby directly, but how bad do we need this? You know, we gotta make the decision, is the mom or baby? Well, okay, definitely not my real go-to. Make sure you have a very good IV or IO site, because it is quite necrotic. Okay. So, while I said this is the go-to for neurogenic, they have a lot of research out there right now that shows with septic shock, okay, that there's a higher survival rate using norepi versus dopamine. Significantly higher survival rate. So it would not surprise me in 2025 when the new American Heart Guidelines come out that norepi is a lot more emphasis. Okay, so it's not a new drug, but it's like what they're finding is it's actually working better than some of the old standards we have, like dopamine. So dopamine, right? Also known as intropin. Dopamine is on page
911.
911, right? I love you, brother. Don't confuse it with dobutamine, which is right next to it.
Already got it circled.
Dopamine, right, starts on 911, goes to 912. We had a little problem with calcium chloride, calcium gluconate. It's all good. All right, it is an endogenous catecholamine. It's a naturally occurring substance in the body, dopamine. It's an adrenergic, a vasopressor, and a positive inotrope. Well, what does adrenergic mean? Adrenaline-like, which is another way of saying, well, where do we find adrenaline? Which part of the nervous system? It's a sympathomimetic type drug. These are very similar drugs. They do very similar things. Immediate metabolic precursor to norepi. This is what your body makes, and then your body converts it to norepinephrine to use in its body. Norepi is the better drug to give, but after we can get dopamine, let the body switch it over to norepi. With mixed alpha and beta and dopaminergic effects. They are dose dependent. So the dose is 1 to 2 mics, right, dopamine. 1 to 2 mics per kilogram per minute, right? And it's 2 to 4, is that how they're doing it in this book? 2 to 10. 2 to 10 mics per kilogram per minute, and then 10 to 20 mics per kilogram per minute. This is nice to know. I'm not testing you on this. Okay. 1 to 2 makes blood go to your kidneys. If blood goes to your kidneys, what happens to your blood pressure? You make more urine, you get rid of fluid, your blood pressure goes
Down.
Do we want to do that?
No.
All right. We don't ever need to be trying to perfuse the kidneys as opposed to something else. We're trying to perfuse the body. So I don't even want you thinking about that. 2 to 10, okay, it does really good at fixing blood pressure, raising blood pressure. Above 10, it doesn't do so good on that, has more cardiac effects, okay? So I'm gonna give you, because I'm gonna talk about a street rule in just a second, I'm gonna give you the street rule dose. Five mics per kilo per minute, and we work up from there. And there's a reason we're gonna go with 5, because you can do this math. I know it looks ugly. You can do this that fast in your head. We're gonna talk about the street rule. Now, we did all these drug counts in the past. Now I'm gonna start giving you some of these shortcuts, right, the street rules. So, at 2 to 10, right, stimulates the beta-1 receptors, increasing myocardial conductivity. At 10 to 20, it's alpha, more blood pressure, okay, whatever. First occurring in skeletal muscle beds, greater than 20. Yeah, if it hasn't worked at 20, it ain't gonna work. Right, so that's why it's 20. Indications: refractory, cardiogenic, or distributed shock, hypotension with low cardiac output states, second-line drug for bradycardia. So forget the bradycardia for a minute. Let's talk about the blood pressure. Right? Contraindication, hypovolemia. Again, if they don't have enough volume, what good is it to constrict the vessels? None, right? So it's never used for hypovolemic shock. Used for all the other shocks, just not hypovolemic shock. Same thing for norepinephrine. Don't use it for hypovolemia, use it for everything else. Okay. Refractory, meaning we've tried something else and it didn't work. In this case, we tried norepi or an epidrip or fluids and it wasn't good enough. We may want to try dopamine. It shouldn't be my go-to, it should be my second or third choice. And it says second line drug for bradycardia. What's my first line drug for bradycardia?
Atropine.
Atropine. If atropine didn't work, what can I give?
Dopamine.
Dopamine or epi or pacing. Norepi doesn't do a lot to the heart rate. Dopamine does. So that's why dopamine's better for bradycardias than norepi, but norepi's better for blood pressure than dopamine. So understanding how these drugs work, you kind of make a little bit better choice on which one to pick. Contraindication, allergies, hypovolemia, uncorrected tachydysrhythmias, VFib. They're in VFib. Do we need to fix their blood pressure? No, we need to start their heart. Do that first. And then pheochromocytoma. Ooh, big fancy words. Pheochromocytoma. OMA, what is that?
Almost.
No. OMA. O-M-A.
That's a German grandma.
Yeah. In Latin, medical terms, what is OMA? It is a tumor. Pheo means dark colored, chromo color, so pheochromo, dark colored, pheochromocytoma, dark colored tumor. This is in the adrenal glands. What happens with this tumor, with this cancer, if you will, in the adrenal glands? It makes their blood pressure skyrocket. So if they have a tumor that's pushing their blood pressure up, do we want to give them something to raise their blood pressure? Nope. That's why it's contraindicated. Pheochromocytoma. Side effects, headache, anxiety, dysrhythmias. It could cause hypotension. Wait a minute, this raises blood pressure. But if I give too low of a dose, it could lower the blood pressure. That's why we're going to start at 5. I'm nowhere near this low end dose. Okay. When administered with phenytoin can cause hypotension. Right. Simultaneous use of vasopressors may result in severe hypertension, meaning pick one vasopressor. Don't be like, well, let's do norepi and dopamine. That's really going to push their blood pressure too high. Just pick one. Okay. Can be inactivated by alkaline solutions like bicarb. Right. TCA is potentiated. Beta blockers can antagonize or block the cardiac effects. Remember I said this is a positive inotrope. It makes the heart beat stronger, right? Beta blockers can minimize that. Adult dose. Now, I explain these. It even says right here, 5 to 20 mics per kilogram per minute. We're going to start at 5 mics per kilogram per minute. Okay. Starts working within 5 minutes. Why? Because the body has to chemically convert this to norepinephrine. And then it's working. Peak effects, 5 to 10 minutes. Duration, 10 minutes. When I turn it off, it's going to take about 10 minutes to stop working. Because you've already got some in their body. So, norepi, I turn it on, it's working. Dopamine, I turn it on, I gotta wait a few minutes to see if it works. Oh, I waited 5 minutes, the blood pressure still sucks. Bump it up. Wait 5 more minutes. The blood pressure still sucks. Bump it up. You know, it takes a while to get dopamine dialed in. Norepi, I can get it dialed in pretty quickly. That's another reason that's kind of becoming the go-to drug. Norepi. Pregnancy category C, fix hypovolemia before giving the vasopressors. So, the street rule. Okay? There's a pretty standard mix of dopamine. you guys wanna work out the longhand math, we will do that. We need to put 800 milligrams in a 500 ml bag, or 400 milligrams in a 250 bag, or we need a concentration of 1600 mics per ml. So again, I have a 500 ml bag. I put 800 milligrams in that bag. My dose is 5 micrograms per kilogram per minute. I'm going to use, it's an infusion, what drip set per minute? 60 drops per ml. All right. Let's do a patient, 176 pounds. Oh, shit, 176.
80 kilograms.
80 kilograms. How'd you get there?
I've rounded up to 180
And cut it in half, that would be 90.
minus the,
Minus 10%, you got 81.
Yeah,
And you round it down. If you actually divide that by 2.2, it's exactly 80 kilos. Right? But, yeah. Huh. I want you to remember pounds. Why? Because most people tell you what they weigh in pounds, unless they're from England, they'll tell you stones or whatever. Yeah. So 176 pounds, which was 80 kilos. All right, so 80 kilograms. 5 micrograms for every kilogram. 400, so I'm just gonna erase this. And we're gonna write 400 mics a minute. All right, what do we cross off?
well, you gotta turn the.
mLs.
Gotta turn the milligrams into micrograms,
Oh shit, they don't line up.
800.
So, can we make this into milligrams? We can, then I got a decimal. Can we make this into micrograms?
Yeah.
All right, so let's make this into micrograms. How do we do that?
800,000.
Isn't this getting ugly? Now my mics will cross off. Okay, now what?
Zeros.
Zeros, let's say I have 5 up top. I got 5 on the bottom. Everybody following me so far?
Yep.
All right, I've got 5 times 4 times 6 divided by 8 times 1 times 1. 5 times 4 is 20, times 6 is 120 divided by 8. Is 15. Took a little while to get there, right? Yeah, that sucked, didn't it? You mix it this way. You use this drip set. Here's the street rule. Weight in pounds. Get rid of the last number. Subtract 10%. 10% is almost 2, right?
Mhm.
There's your drops per minute every time. 300-pound patient.
27.
27. 30, 300, get rid of this 0, you got 30, take away 10%, minus 3, 27. You wanna figure the math? 114 pounds. Little old lady.
10.
170.
16.
15, 1.7 is closer to 2. But if you're off by one number, okay, was it 5.5? You see my point?
Yep.
That gets you that dose every time. If you use that mix with that drip set. That's how these guys are doing dopamine that quick in the field. How much do they weigh? I don't know, about 260. 26, typically 23 drops a minute. How'd you do that? That's how. Paramedic, yes. It only works for dopamine. Okay.
Not used for PDs?
No, dopamine is not given for pediatrics. We can't get low enough doses with the weight.
Okay.
So here's my 3-year-old kid that weighs 15 kilos, 33 pounds. All right, get rid of the last number.
3.
Okay, so I got 3, take away 10%, I got 2.7. We'll still call it 3. 3 drops a minute. How are you gonna get that? It's virtually impossible to get settings that low.
Okay.
By the time you get that dialed in, okay, now I gotta wait 5 minutes to see if it's like, we just don't use it.
Understood.
Make sense? Yes, ma'am?
On the test, you want 5 or 5 to 20 micrograms?
Give me at least the starting point.
Just
Just know that if it doesn't work, it's gonna go up. I know I kept you a little late, I apologize. But, when I say go up, don't try and go like, all right, let me redo the math for 6. No, 5 was 15 drops, right? 30 drops would be 10. Let's see if that works. Oh, that's a little too much. Now back it down to 20 drops. You know, just, that's what